Ready to
Hi
go?
everyone. Hi everyone, I'm Demi. I'm a second year medic at Oxford, and I'm the head of personal statements at my UCAT. And most of you will probably know Ojas, but if you want to introduce yourself as well.
Hello, everyone. I see that we have a small number of people who've just left. So I'm guessing all of you guys are here to be learning about your personal statements today. Thank you so much for coming along. As you guys know, I'm Ojas. I'm the founder of my UCAT. I do med at Oxford. And let's go to the next slide if we can. And I run this organization where we have kind of hundreds of tutors from across the UK, some of the highest UCAT scorers, and we provide support with all aspects of the medical and dental application process. And you can see that that includes UCAT, interviews, but also a big focus on personal statements. And if we go on to the next slide, which I think is about our personal statement team, you can see that we have Demi, Charlotte, and Tanya, who put a huge amount of work each year into making sure exactly what each and every UK medical and dental school is looking for, what sort of criteria, how the personal statement is actually being used by each and every medical and dental school. So stay tuned, and we're going to be providing lots of very specific advice on exactly what you guys need to do and exactly how you can make a personal statement that matches all the medical and dental school criteria. And I'll just make sure there's no annotating on the screen. So I'll disable that for everyone else. I believe, Demi, you might have to do that. So if you just disable annotations.
How exactly do I do that?
How exactly do you do that? If when you click to annotate on your settings, I think next to screen share, it will show an option for only you can annotate or only host can annotate. It's fine. Let's trust them to be responsible and keep
Okay.
going.
Yeah,
Hopefully
I
they
like that
will be.
idea too. Yeah. So like I just said, we've put a lot of research into knowing exactly what different medical schools are looking for. And we're going to go through that in today's session. Um, it's really important. Some of the medical schools do score the personal statement, others are looking for certain criteria. So it's really crucial for those that score it that you tailor it exactly to their specifications, which we'll also show you. Okay. So this is a little bit about UCAT interviews and personal statement. We've had lots of really good reviews. Um, so hopefully this shows you that we do know what we're talking about. These are some of the reviews of the personal statement help that we offer, which a lot of the advice we give in this talk will be about. So what actually is the personal statement? Can we allow the chat to be put back on, see if anyone's got any ideas about the new format, see what people know?
Well, add to that, how important do we think it is? So let's answer both of those questions. It has three questions. That's a good start. Is ChatGPT allowed? No, it's not. It can help you structure your thoughts, maybe, but definitely not to write it.
Yeah, UCAS gives very clear advice on this. They said that it is okay to use AI in the planning process, but not to write the actual sentences. That should be completely your own thoughts. And they do have AI checkers, and you've got to be really careful. Make sure it is you talking about it, because obviously you don't want to be ingenuine, especially if you're applying to medical school.
Amazing. So I've got lots of things in the chat I'm seeing, and some of them say that it's very important. Some of them say that it's not important at all. Now, the very smart ones have said it depends on the university. And we're going to cover that in a second, exactly why that's the case. But the answer is that it can be very, very important if you're applying somewhere like Kiel that is scoring it and that's using it to shortlist. And for other medical schools, if you're applying somewhere that could see it at interview, it could be pretty important because it's determining the kind of stuff you'll say at interview. And if you end up with things on your personal statement that are dishonest or that you're not confident talking about, that could be the make or break for your medical dental application. So, in some ways, it can be important. Equally, we're going to show you guys in a second how we've got lots of students getting into both medical school and dental school. And if you're applying to a university like that, where you can apply to both medicine and dentistry, then obviously in that case, the personal statement is not going to be very important. So the answer is that it really depends on what your medical or dental school is, but depending on where you're choosing to apply, it could be very, very important.
Yeah, definitely. So, like some of you said, there are now three questions. The first section is why do you want to study this course or subject? The second one is how have your qualifications and studies helped to prepare you for this course or subject? And the third one is what you've done to prepare outside of education and why these experiences useful. Um, it still has the same 4,000 character limit. Each section you have to have a minimum of 350 characters. Um, and it's still good to try and link things together, but we'll go through exactly what you can include in each of these sections later on in this webinar. So this is how different unis use the personal statement. Um, so some of them don't use it or read it at all. So this is where we really want you, if you're going to apply to four medical schools and a dental school as your fifth option, or vice versa, these are the ones you should be applying to as your fifth option. So for dental applicants, Brighton and Sussex, Bristol, Plymouth, Sunderland, Sheffield, and Manchester don't look at it at all. So it'd be good to put med as your fifth option if this is something you want to do for these unis, as they're not going to check that you've actually applied to dentistry. For medicine, Anglia Ruskin, Lancaster, Queen Mary's, Leeds, Lancaster. And then scored for shortlisting, Kiel. So they score this out of 15 on criteria that we're going to go through. As well as this, there's Bolton, Brunel, UCLN, Buckingham, and those two are both like some of these are private unis. So more of the private unis, they'll be putting more of an emphasis on this. Then we've got others that just check it based on the minimum requirements. So to make sure you're actually doing medicine, some of them might look if you've got any work experience and reflection in there. Some of them will be checking for big red flags, which we're also going to tell you a bit more about. These are Bangor, Cardiff, St George's, Edge Hill, Hull York, KCL, Newcastle, Belfast, Birmingham, UEA, Exeter, Glasgow, Lincoln, Nottingham, St Andrews, and then the ones that we'll use if it's borderline. So if they are deciding between two really strong applicants who have very similar UCAT scores, very similar GCSEs, if that's what they're looking for, they will use the personal statement to see which of these applicants they might want to invite to interview. So these are Kent and Medway, KCL, Cambridge, Edinburgh, Liverpool, and Oxford. Then we've got some that might question at interview about this. So, like Ojas was saying, you really want to make sure that you haven't lied, that you are only talking about things you'd be confident talking about in interview for these ones. If you've read an article or a book, you want to make sure that if they've also read the book, they might question you on it. You want to make sure you do actually know what you're talking about and you can reflect on that well. So for the ones that may question it, we've got Aberdeen, Aston, Oxford, Cambridge, Dundee, Southampton, UCL, Imperial, St Mary's, and UCLM. Um, it's not always the same for home and international students, um, like it says here, but these are mostly for home students. We've got Oxford and Cambridge. They'll tend to not do the whole interview on the personal statement. It'll tend to just be a bit of an introduction at the start, just to kind of ease you in. Most of the time, they're trying to make you feel comfortable because they know you'll know your personal statement well, and then it'll move on to the more sciencey questions. Did you experience that yourself, Ojas?
Yeah, definitely I did. And I think what a lot of applicants find is, well, we're not allowed to say exactly what they asked us. What a lot of applicants find is that they'll be eased into the interview by usually picking up on maybe something scientific from the personal statement, though not necessarily always. And they won't necessarily ask exactly what you've written there. It might be a little bit beyond that. So suppose you mention a certain condition and you say that, okay, this is what you observed and this is what you learned. They may ask something slightly different about that condition that maybe you've not written about. And it's just to see maybe, did you think deeply about what you saw? Did you explore it a little bit further, maybe beyond your school curriculum? And even like, can you come up with ideas and apply your knowledge based on what you already know? So if there's anything, you're applying for Oxford or Cambridge, and you've mentioned any medical conditions you saw in your work experience, any books you've read, any research projects you've done, really anything scientific at all, definitely know that stuff inside out. And obviously the soft skill stuff as well that you'll be doing for your other universities, but especially anything scientific, they very easily could ask about in the first couple of minutes of interview. And some of the students in the last couple of years who I've known to struggle have been the ones who've shown up to colleges that like to ask a bit about personal statement, and they haven't necessarily learned it, or maybe they've spoken about stuff that they've now forgotten, or maybe didn't know much about, and they thought that writing about it would impress the interviewers. But that's not quite how it works. So make sure you only write about stuff that you've actually been reading about.
Yeah, exactly. And with the personal statement, because it is such a short statement and you won't have many characters to explore each thing, if they're going to question you, they're going to want you to explain it a bit more. So this is really why you should make sure you know it from the bottom of your heart. Then we've got some unis who require a different form, like an R&R form or the BM6. So these are Sunderland, Cambridge, and Southampton. That will be testing things similar to the personal statement, but it will be mainly tailored to certain questions about something they want to know. It could be volunteering, it could be work experience, things like that, rather than the UCAS questions. As I was saying, it's not always the same for home and international students. We've said Keel score to shortlist you for interview, and then they pick people based on that ranking. For international students, this isn't the same, and they'll be scored on their UCAT rather than the personal statement. And then Kent and Medway, home students, so students from the UK, they're shortlisted based on their GCSEs, and international are scored on their personal statement. So it's really crucial, depending on if you're home or international, that you know this inside and out. Similarly with Oxford, they don't score the personal statement, but they will score your UCAT and your GCSEs and shortlist based on that, and then look at personal statements if borderline.
Just one thing I wanted to add, actually, some people are asking about, if we just go to the last slide. People are asking about these roles and responsibilities forms and what they are. So what you'll find is that a number of medical schools, especially if they don't use the personal statement, so one like Sunderland that doesn't look at it at all, they might use this additional form as a way of collecting information. So nowadays, Sunderland does it for medicine, Liverpool, Manchester do it for dentistry, where they instead will use this form for shortlisting, and they might be asking you to supply information about your volunteering, part-time job, any insight you've gathered into medicine and dentistry. And so it will be usually this that is important instead of the personal statement. Now, that's not always the case. Like Cambridge has a My Cambridge form, and they focus on both that and the personal statement. But usually, when they have one of these supplemental forms, this is something that's going to be used in place of the personal statement. And that's why, for example, Manchester dentistry is a good fifth choice because you can always fill in a new supplemental form that will replace your personal statement. Now, if you need help with these supplemental forms, we can definitely offer guidance for them. And in the past, we've been helping with like Cambridge, Sunderland, Southampton for the widening access program. They ask for one of these. One of the ones that I'm seeing a few people mentioning in the chat are Kiel and Manchester. I would emphasize you might see a lot of information online that says Kiel and Manchester for medicine have a supplemental form. This doesn't exist anymore. So Kiel scores the personal statement now, Manchester for medicine uses neither. It does still exist for Manchester dentistry, but just be aware of that. If you've seen any information online, it may not necessarily be accurate. So do either use something like this or reach out to the universities.
Yeah, they'll normally have completely updated information on their admissions pages, which is where we get a lot of our info from. But there is a lot of misinformation out there. Manchester did used to use a non-academic information form, but this isn't the case anymore. They removed that last year, like I just said. Okay, so for dentistry, there are some options that are safe for medical applicants. So if you've got your four dentistry, and then you want to do a fifth one as medical, we'd be advising you to apply to Bristol, Plymouth, or Manchester for your dentistry. And then we've got again the ones that check it for basic minimum requirements or shortlisting for making interviews if it's borderline. These would be Birmingham, Cardiff, Glasgow, KCL, Leeds, Newcastle, Queen Mary's, Belfast, Aberdeen. Then we've got some again that may question it at interview. These are going to be Dundee, Liverpool, Queen Mary's, and Aberdeen. Like I just said, some of them use a separate form. For this year, for dentistry, this is just Liverpool and Manchester. And then we have some that score it for shortlisting. So we've got Sheffield and KCL for some graduate entry programs as well. Okay, so we regularly get 5 out of 5 offers from both dentistry and medicine. So it is definitely possible if you apply to the right places with a sensible fifth choice. If you try to apply somewhere that does read it, it's not going to be as successful. So we would advise against that.
You guys
So what do you guys,
recognize sorry.
sorry,
Do you guys recognize from the chat Angel from the Midnight Words? Has anyone been reading those on UCAT experts?
I tend to miss
Maybe.
them.
Let's see. Has anyone been reading them? Yes, some people read them. Amazing. So she got into all five, both medicine and dentistry. Going to Imperial now. So it's definitely possible. Just make sure you're strategic. And if your teachers are causing problems, take a picture of this slide, send them this on the Plymouth website, and it is definitely possible. Now, if you're not sure where to apply, we've got the information here. We've got our strategic application guide. Definitely check that stuff out.
Yeah, a lot of teachers will tell you you can't apply to medicine and dentistry. I'm sure Angels schooled it as well. But it's simply not true if you do a strategic application. So if we can open the chat again, what do you guys think medical and dental schools are looking for in the personal statement? You can see a lot of
Oh, and
reflection.
one thing I can think of, do they need to stand out? What do we think, guys? Do we need to stand out? And if so, why do you think you need to stand out? So, firstly, there's no real need to stand out because at no point are they saying, let's look at this personal statement, let's look at this personal statement. This one looks a bit better, let's give this person the interview. Because you're being shortlisted based on your UCAT score, or if you're talking about the very niche ones like Keel that are going to shortlist you based on the personal statement, they have very specific criteria. So, do you need to stand out, as in say something outrageous about how you've cured cancer? Absolutely not. That's not going to be helpful. Do you need to stand out, as in meet all the criteria that we're going to talk about? For example, on the Oxford website, on the Kiel website, make sure that you're reflecting on your experiences, having really good things to say at interview that make you a strong candidate? Yes, absolutely. So, do you need to stand out by being different from everyone else? Absolutely not. Do you need to stand out by doing all the things that they've asked for and writing about them? Even if other people have done the same thing, then that's completely fine.
Yeah, exactly. A lot of you have got it really right in the chat. Schools are looking for reflection. So, like I just said, doing all these things is really good, but don't do them without reflecting on it. They don't care that you've done um, 3 rounds of volunteering and 10 work experiences. Just listing that won't impress them. It's really the reflection that they will appreciate. So, this is just a bit of a guide for what med and dent schools will be looking for. So first, we've got some essential skills. So things like empathy, teamwork, communication, analytical skills. Like I said, don't just say you've developed them, but show how you've developed them, where you saw them, and if you've then emulated, so repeated them in your own work experience, volunteering, etc. Then they want to see a genuine motivation to study medicine or dentistry. A lot of people go into it for the wrong reasons, unfortunately. They'll think there's a lot of money in the career, there's family pressure to do it. Um, if there is family pressure to do it, obviously maybe consider other options, but don't say that your family are studying medicine, because it will make them think there is some family pressure there, even if there isn't. Um, and a big thing here that I see a lot is don't just say that you want to help people and that you like science, because everyone really says this, and a lot of careers can do that. We want to see why you want to be a doctor over a nurse who also helps people and is related to science. So is a science teacher, so is a pharmacist. What is it about medicine or dentistry that's drawing you to that? Then we've got a bit of exploration and reflection. So you want to explore the subject and career. That could be through your work experience, your volunteering, MOOCs, articles, books, any of the extracurriculars or supercurriculars that you've done. Like I said, don't just list these, reflect on what you learn and what skills you develop from them. And then you could try and link the different extra and supercurriculars together. So I did X and that led me on to think Y, and then I did Z and I learned this and developed this. Then they also want proof that you'll succeed. So they want proof that you're capable of being a uni student. So you could do things that uni students do. You could read articles. It could be for an EPQ, it could be for an independent project. You might just want to read a certain article on a NHS hot topic, for example, or some science that you enjoy. You could write an essay, particularly for unis like Oxbridge, that you'll have to write two essays, for example, a week, depending on the college. This will impress them and show them that you are suited to their style of learning. And then things like attending a free summer school. So there's a lot of these with the Sutton Trust, unique for Oxford. You don't have to pay loads of money to do summer schools. Like some companies will make you think it's just not needed, and you don't tend to learn as much from them rather than the free ones. And by doing these, you'd be going to lectures, you'd be going to tutorials, seminars, things like that, just proving that you can do stuff that a uni student can do and that you will be successful in the course because they want to know why you and not somebody else that's applying. And then finally, we've got realistic insight. The NHS is not by any means easy to work in, and you want to prove to admissions teams that you know that and you understand it, and yet you still want to go into the career. Be careful putting too much emphasis on research as well if you do want to go into research, because the NHS is struggling for doctors, so they want to admit people to medical school who want to go into clinical. So if uni's like Oxbridge, you can sprinkle in a bit of research there, but just don't put too much emphasis on it. So just to prove that the NHS isn't easy to work in, I've got a few statistics. So currently in the NHS, there are 112,000 unfilled vacancies. So the workload's a lot. You might be having to take on extra workload to meet the demand that these vacancies are unfilled for. 1 in 5 doctors are considering quitting or moving overseas. 1 in 3 med students plan on leaving the NHS within 2 years of graduating. 38% of doctors reported struggling to cope with the workload at least once a week in the 2024 NHS staff survey. 61% of resident doctors are reported as at moderate risk or high burnout. If you are going to talk about resident doctors, make sure you refer to them as resident doctors because it is now changed from junior doctors. And there's been a 21% reduction in real terms pay for resident doctors since 2008. So it isn't the glamorous career that people expect it to be. And I'm just saying that not to scare you, but in case you did think it was, and just show a bit of this realistic insight. If you go onto the Oxford website, there's a personal statement that you can see, and it literally starts with, I haven't always wanted to go into medicine. And that proves to them, okay, this person knows what they're doing. They're not going to be shocked when they find out the NHS isn't great at the moment, and going to drop out. They want people who are going to stick through that course and give them the money for the 5 years and go on to be a clinical doctor and fill these unfilled vacancies. So if you prove to them that you know that it's not easy, you're going to be more likely to be one of those people that's successful. So then we've got the GDC, the General Dental Council, who also give a few skills and attributes that they'd like dental applicants to put. So the ability to apologise and recognise duty of candour, so being open and honest with the patients. The ability to appreciate the complexities of healthcare consent decisions. It's not always easy, and there's a lot of situations where it's really difficult, or sometimes people can't give consent. For example, under 16s, things to do with Gillick's competence and the Fraser guidelines, for example. Ability to show respect, empathy, and care. Ability to take responsibility for your own actions. Ability to work as part of a team. Conscientiousness. Courage to advocate for patients. Effective and appropriate communication, including written and spoken. So they'll probably see a bit of that from how you've wrote a personal statement. It doesn't have to be flowery, romantic language. Actually, we'd advise against that. Honesty, individual responsibility and resilience, integrity, motivation to study dentistry, again, really important, and a proactive personal insight, self-reflection, and self-development, like we've already emphasised. So, some common mistakes in the personal statement. What do we think people tend to make as a mistake? Ojas, could you open the chat? Yeah, great. Yeah, I'm seeing a lot of cliche. Yeah,
Oh,
just saying that you
nursing is
thought it.
bad. That's a first. I don't think I've ever seen a personal statement saying nursing is bad, but yes, absolutely don't do that.
Yeah, I think what this person means is a lot of people will try and show why medicine and not nursing, for example, but a lot of people can tend to put nurses down. There are a lot better ways to go about showing the differences between the professions, without putting nurses down because they're such an important part of the multidisciplinary team. So please don't do that.
Would emphasize if someone is asking you a question, so say you've talked about why medicine or why dentistry, and they then give you a follow-up, so why not nursing or why not dental hygiene and therapy? In that case, you can definitely talk about stuff like extended degree, covering lots of science, opportunities to do research that are integrated into the degree with intercalation, scope of practice, the fact that you're able to prescribe, you're able to diagnose, and while other careers can do this, this is the main focus of your profession, the opportunities for leadership in the multidisciplinary team, all this stuff referred to, but do not bring that stuff up comparing medicine to other careers unless it's specifically asked of you. So if you have a personal statement and it's about why you want to study medicine, then just talk about why you want to study medicine, not why you don't want to study other things. That's only if they ask you, you would then refer to it.
Yeah, exactly. A lot of people have got the exact right answers here. Cliche, dishonesty. Someone said, I'll change the world by being a doctor. Obviously, nobody is expecting that, and it can be a bit exaggerative. Okay, so these are the ones that we see most often. So, like you all said, being cliche, I've always wanted to be a doctor because I love science and helping people. You haven't always wanted to be a doctor, not since you were really young, and it doesn't impress them if someone's only been considering the career for 6 months versus 5 years. It really doesn't matter to them. It's about what you've done to explore that. Then being vague. So, my work experience helped me develop skills that will be crucial as a doctor. Brilliant. What did you see on your work experience? What are these skills that are so crucial? You really want to show them you know what skills are crucial to being a doctor, and this doesn't really say that. And then not reflecting. I did work experience at a hospital, a GP surgery, volunteered at a care home for people with dementia, and completed 3 MOOCs. Great, that's really good. You've probably got a good insight into the career, but we can't see that, and you really need to reflect on it, which we will show you some methods to do soon. So these are our top tips. Somebody just asked this in the chat if you have to talk about the multidisciplinary team. You don't have to, but it is a good word to include, especially if you've done some sort of work experience. You can talk about how the multidisciplinary team work together. Then we've got primary prevention. So that's like basically trying to tackle issues before they become issues. So with obesity, for example, that's quite a big risk factor for a lot of cardiovascular disease, type 2 diabetes mellitus, a lot of different conditions. So GPs also have a role in trying to, bring down obesity, inform people about healthy lifestyles, dieting, exercise, portion sizes, things like that. And then we've got holistic. So if we're talking about care being holistic, we're basically saying that we're not just considering the illness by itself, we're considering their social factors, their nutritional factors, everything in their life, their family life, stresses, work. You try and consider everything and make sure you're getting the whole picture, not just focusing on a single illness. You want to think about how it affects the patient as well in many other aspects. And then patient-centered care. So as time's gone on, we've moved with the NHS from a more paternalistic care where the doctor used to make the decision and that was it, to patient-centered care where doctors and other healthcare professionals are trying to make sure that the patients are actually involved in their care and that they have a say and that they agree with the treatment plan, things like that. Don't include anything you don't feel comfortable speaking about at interview. Like we've already emphasised, this is really, really important. You don't want to be caught out. If you don't understand the definitions of these words, hopefully we've given you a bit of an understanding, but don't go and put anything you don't understand. Because they could ask you at interview if it's one of those that use it, and they could say to you, okay, what does it actually mean by patient-centered care? And you'll be like, oh, I don't know. You don't want to get caught out by it.
Just one thing I saw in the chat I think might be quite interesting. If we just go back to the common mistakes slide of I think two back. So people are saying that if I don't talk about loving science and I don't talking about helping people, what do I talk about? Now, the thing is, I'm not saying you should avoid a scientific interest or you should avoid referring to your desire to make a difference for others. It's just don't say it in those exact words, actually explain why. So don't say I love science, explain actually what about science is it that interests you? Did you do a project for your EPQ or did you enter the My UCAT essay competition? And did you find out about, for example, use of immunotherapeutics in cancer and how they're a big advancement in oncology? And did you find out about, for example, some recent cancer vaccine trials taking place and what difference they can make for ovarian cancer? And why specifically did that interest you? Well, because you can think about the massive impact they're going to have on patients. And for example, in your work experience, you came across an oncologist explaining to a patient that they're eligible for an experimental therapy, and you saw what a huge impact that had on the patient. It transformed their life. As you've seen, I've just gone through loving science, I've just gone through helping people without using those exact words. So it's not about avoiding those two things, it's just about being very specific about why those two are the case.
Exactly. And I think if Ojas was a student applying to medical school, you could clearly see that he does love science. A lot of people can say they love science and they love helping people, but what have you actually done that shows that? Unfortunately, some admissions team will just think that you're making things up, that you're waffling. So you can really prove to them and showcase your love for science if you do something like what Ojas just suggested. Okay. So, how and where to start? A lot of you have said that you haven't done your UCAT yet, so a lot of you probably won't have started on your personal statements. So, a good thing to do is search up your uni name and then medicine selection criteria and see if any selection criteria come up. Some unis will have some out there, and we'll go and have a look into those in a second. Or for unis that score the personal statement like KCL, use their criteria and make sure you're meeting it very exactly to the point, even if that means that you're reusing some of their words. I did this in my personal statement for Oxford, and I think it just really pinpoints that you are meeting their criteria. If they don't have any criteria, there are a lot of skills listed throughout the website rather than a bullet point list. You can use those, you can use examples that we've already discussed in previous slides. Then what I'd say to do is I'd say create a list of this criteria that they're looking for. And then alongside it, create a list of your extra and supercurricular activities, your work experience, your volunteering, anything you've done. Then try and link them together. See which activities require which skills and which ones you developed from each activity. And then you want to decide which section of the personal statement you're going to put each thing in. And then you want to then build on that with using reflection methods, which we'll talk about a bit later, to start drafting this into sentences. So we're going to have a go together with some of my extra and supercurriculars. And this is the KCL criteria. So like we said, KCL scores the personal statement out of 15 on this criteria. So we want to make sure we're meeting it exactly. So these are what I've done. So I did some work experience in cardiovascular and respiratory and in trauma and orthopedics. Then I did volunteering in a care home for people with dementia. I led a project providing activities for people with dementia, linked to that care home volunteering, and we connected different generations through stories. So we used the people's in the care home stories to then connect them with the younger generation because we thought there was quite a bit of a divide between the older and the younger generations. I did an EPQ on whether understanding the pathophysiology of chronic conditions is essential for providing effective treatments. I read a book called Glucose Revolution, listened to podcasts on how acute illnesses become chronic, and read some peer-reviewed articles. I was the chair of student council. So for criterion A, they say they want people to understand the roles of a doctor within the healthcare team, community, and society, going through your personal research and experiences. I've titled these 1 to 6. I want to see which of these you think might be applicable to criterion A. Yeah, I can see a lot of you putting 1. I would say definitely your work experience really shows this, especially if you've done work experience in a healthcare setting. You're probably going to see the multidisciplinary team working together. and it is going to better your understanding of a doctor. Um, but also, you could do research online, you could attend a webinar, you could attend some of the My UCAT supercurricular talks. A lot of these are giving you an insight into what the career is like. Yep, two could definitely be it as well. Um, that is more so in a care home that they didn't tend to be doctors, um, but we had a lot of people um, in healthcare working there. So you definitely could see some of the roles within the community and the society, definitely. Okay, what about B? So awareness of the range of knowledge, skills, and behaviours a medical student must acquire and why these are relevant to you. Yep, we've got a range of answers here. And for this one, whilst it seems quite vague, a lot of your experiences you can link to this. So for my volunteering, for example, I developed a lot of empathy, and I really developed my communication skills. These were people who were sometimes hard of hearing, people with dementia. You do have to adapt your communication to individual needs, and you'll have to do that throughout your entire career, as a medical student and as a doctor. So that one's a really good one. And then, for example, leading these projects alongside my studies, reading books, that's relevant to a medical student because a medical degree is hard, it's intense, and you have to put in a lot of work. So if you can prove that you can do your A levels alongside projects or long-term commitments, that would be really good as well. Okay, what about C? So evidence of a skill acquired through your school, college, or university studies that will be important for becoming a doctor. Yeah, exactly. And this one is kind of like the second question um, in the new format. So it's about things you've done in school, but also outside of school. And that's where there's a lot of misunderstanding with this question that we'll come on to later. But my chair of student council, I developed a lot of communication skills there, leadership skills. A lot of you have said four. I did some research there, which medical students and doctors will have to do. There's research happening all the time, and doctors need to know how to read this to make sure they've got the most up-to-date information for their patients. What about D? So, ability to engage and communicate with people from a variety of backgrounds and to help or support them. Yep, a lot of you are saying two and three. So, because I was working with people with dementia, for example, I proved that I'm able to engage and communicate with different people. And then you can link that to how that will be helpful in your career as well. And finally, E, ability to balance responsibilities and time commitments over a prolonged period. Yeah, definitely five. Yep, exactly. I would say two as well because I did volunteering for a year. It's definitely not needed. You could volunteer for a week and you could still gain a lot from it. I just particularly enjoyed my volunteering, but I did that for a prolonged period of time alongside my studies. Great. So then we've got Oxford. I'm not going to go through it in the same way, but they also have some criteria that they look for. This isn't just in the personal statement, it's in the interview as well. And then some of the academic ones they'll see from your UCAT score, for example, or your GCSEs. But we've got things like ethical awareness. So with this project I was doing with people with dementia, obviously we're sharing their stories, and I had to gain consent from people with dementia. As a lot of you might know, people with dementia do have reduced capacity and in some cases can't give consent. So I had to reach out to a dementia researcher to try and understand a bit more about taking consent from people with reduced capacity. So that kind of meets the ethical awareness one. Communication, I've communicated with people with dementia. I've communicated with people in my work experience. Motivation, I've gone and explored if a career in medicine is actually right for me through my work experience, through my wider reading, etc. All of these, I've put the links below. You'll get the recording after, but these are where you can find these criteria to look through when you're writing your own personal statement. Okay, so question one, why do you want to study this course or subject? So some things that you could include, your personal motivations for wanting to pursue medicine. It could be a chat with your GP, volunteering in a care home, having a sick family member. These are some suggestions that UCAS gives, but it could be anything personal to you. Please try and make it personal rather than it being cliche. Like I said, a lot of jobs can help people. So, what is it about medicine? You can try and be specific. So, diagnostics, prescribing, primary prevention. With prescribing, that could be one way that you differentiate yourself from a nurse, for example. Some nurses can prescribe, but they'll have to do certain training in a certain field, and then they can only prescribe within that field. So, for example, an asthma nurse, they can't prescribe anything outside of their field, but they could prescribe salbutamol with inhalers, things like that, specifically related to asthma. Okay, so this is an example paragraph that I wrote. So, undergoing an appendectomy as a teenager was not only daunting but also eye-opening, prompting me to reflect on how an organ once thought essential can sometimes cause serious illness. So clearly, you've had an experience. It's quite a different opening sentence. Like we said, you don't have to stand out, but this is one way you could make it different to I like helping people, I like science. And then I've reflected on that. This would be quite good for Oxford as well, because they tend to have a more scientific approach. Then linking it to the doctors. I was inspired by the doctors' commitment to patient-centered care, one of our buzzwords, as they clearly and compassionately communicated the benefits from risks, allowing me to make an informed decision on my surgery. Again, an ethical awareness, you know about informed consent. To deepen my understanding of the profession, I attended a medical conference where I learned more about the NHS values and the doctor's role, not only within the multidisciplinary team, another buzzword, but also in primary prevention, another buzzword, particularly tackling conditions like obesity that place growing demands on the NHS. These values, especially the commitment to working together for patients to not only save lives but improve them, that's one of the NHS's values, resonated with me and were reinforced when I supported a close friend with anxiety. Whilst her health was not at immediate risk, her quality of life was deeply affected. I think this is really important because a doctor's role is not just to save lives, but also to improve lives. Highlighting the importance of holistic care, another one of our buzzwords. Hearing how her doctors had to balance the risks of SSRIs on liver function with the patient's mental health, it became clear to me that doctors carry a unique responsibility to diagnose accurately and carefully weigh the risks and benefits of prescribing and continuing treatment. So I've kind of linked it into exactly why I want to be a doctor here. Reading The Body Keeps the Score, which explores the relationship between psychological stress and physical symptoms, further underline the importance of listening, validating, and building rapport with patients. That line's kind of showing empathy and a bit of further exploration as to why I want to go into medicine. Experiences like these, alongside the chance for ongoing learning and professional development, have strengthened my desire to pursue a career in medicine. So just wrapping up that paragraph and showing why all these things make you want to go into medicine. Talking about ongoing learning, you'll have to learn constantly throughout your career. Like I said, to make sure you're giving the best care to patients, but also to continue your professional development. So there will be certain like criteria that you'll have to meet as a doctor. You'll have to do a certain amount of activities to explore learning a year, things like that. So that's just showing an understanding of the profession there as well. Do we have any questions on this one? Anything I've not touched or anything you're wondering why I've put that sentence in this paragraph?
I think we're okay. They seem quite happy.
Great. So with this, I would kind of say, as I went through, I gave you a reason as to why I put every sentence. I think that's a good way to look at it yourself. Is the sentence that you've written, is it showing them something about you? Is it telling them something different? Yeah. Okay, so moving on to question two. This is the most misunderstood question. How have your qualifications and studies helped you to prepare for this course or subject? So UCAS says you can give examples of how you've got involved in school life, your local community, and other club societies or organisations. So, like I did, this could be on your school council, you might be head boy, head girl, things like that. Essay competitions, we've recently had some for my UCAT, I'm sure there'll be more coming up. Um, but things like that would be really good. Olympiads that you've done in school. And then you can talk about any formal studies, so your EPQ, MOOCs, online courses, the My UCAT supercurricular talks coming up. You can talk about your A levels, but this isn't necessary. If you do, however, you should link it to skills that will be relevant to medicine and medical school. So it could be managing workload, um, communication, empathy, analytical skills, anything that you've learned from your A levels, you can include. But this isn't just what the question is focusing on, it can be any studies you've done. You can also link things to wider reading or projects you did as a result of these A levels. So if you had a particular interest in biology, for example, and you went and did a bit of further reading on it, you could link it in here. I've also put the link to where you can find out more about the supercurricular talks. They're all free, and there's some really interesting topics coming up. So I definitely have a look at that if you want something to talk about exploring in your personal statement. So then here we've got a bit about how to reflect. So I've mentioned that if you are going to talk about all these things, reflection is so important. We've got a few different methods of how to do this. So the STAR method. So first you want to introduce the situation, then you want to say what task you've done and the actions you've done, what happened as a result, and then how you've reflected on it. We'll give you an example of this in a second. Then we've got the ABC method. So the action, what you did, the benefit you got from it, and then linking it back to how this is important for your course. These two are really for reflecting on your own experiences that you've done. The STAY method, so the situation, theme, analyse, and you, is more for reflecting on work experience or observation, which will go in section 3, as we'll have a look at in a minute. So this is the STAR framework, and this is how I use it in my personal statement. So the situation, give some context into the situation and insert into why you did the experience you're discussing. The task, what was your task or role in this situation? Action, what exactly did you do? The result, what was the outcome of the situation? And then you want the reflection. So how has this experience prepared you for medical or dental school? What did you learn from it? So for mine, situation, I said to understand the demands of studying medicine. So that's the situation here. The task or my role, I took part in the University of Oxford's unique medicine programme. What exactly did I do? Where I attended lectures and tutorials and wrote an essay on why defects in the APC gene increase the risk of colorectal cancer. What was the outcome of this situation and how has it prepared me for medical school? The outcome was this has strengthened my multitasking and prioritisation skills. What have I got out of it? How has it prepared me for medical school? Thus preparing me for medical for the high workload of medical school. So you don't have to go into loads of detail, but this is just a short paragraph to show them that I can deal with the high workload of medical school and I've got proof as to why I can. Then we've got question 3. So what else have you done to prepare outside of education and why are these experiences useful? So this is literally anything else you've done outside of your education. It could be your work experience, it could be your volunteering, you might have a part-time job, extracurriculars. Again, you want to make sure you reflect and link back to how this information, experience, or the skills you've developed help you in medical school or as a doctor. Most things in section 2 can also go in section 3, and this is where the confusion is a little bit. But the main distinction is whether it's something you've done as part of your formal education, or if it's led by an organisation, or if it was completely self-driven. So things like the My UCAT supercurricular talks, they're delivered by My UCAT tutors. That's not fully self-driven, that's by an organisation. Same with MOOCs, EPQs, A levels. Then if it's something like your wider reading, if it's linked to the things from your formal education, put it in section 2. If it's linked to any of these things, work experience, volunteering. So for example, I did volunteering on this made me think this, I went and did some wider reading to find out more. Then you'd want to put that in section 3, just to show that intellectual curiosity that you've seen something and then thought about it after and gone and done some more research on it. So this is Ojas's personal statement. I don't know if you want to go through this one yourself, Ojas, and read it out and talk about the framework for the STAY method.
Amazing. Yeah, of course. So we've gone through kind of two frameworks for reflecting already. And the two things that you can see is kind of the previous framework when we've got STAR is very focused on when you're given an experience that perhaps was entirely independently organized. So maybe you did some volunteering, you had a certain part-time job, and you're talking about what you learned from that experience. What I've given you here is perhaps a way that you can approach reflecting on things that you've seen in your work experience, things that you've seen while volunteering. So I've given you this framework stay, and it's talking about a specific situation, and that's generally the place to start. So a lot of the time when I'm seeing personal statements that students send in, they talk about, I have done work experience in XYZ wards, and it was amazing, and they make a list. And then they, in general terms, say that during work experience in general practice, I found out about a diverse array of different cases, and I learned about these different skills. Rather than that, to try and prove the fact that you've actually been there and you have something quite specific and original to say about it, I would focus on one particular case that is really memorable for you. So in this case, you can see I've focused on an experience from pediatrics, and I saw a mother come in who was very frightened about this medical procedure that the son has to go through. And so after I've identified this specific case, I would then want to pick one of the themes that has come up from the Medical Schools Council and that a lot of different medical schools have in their selection requirements. So something like communication, something like empathy, teamwork. These are all things that medical schools are looking for examples of, and I would pick one of those themes. So in this case, I've referred to good communication, and that would be the example that I am choosing to reflect on. And by reflecting, I want to make sure I'm very specific how that has actually been achieved. So don't just say that, for example, I've seen good communication, I am a good communicator, but exactly how has that been the case? So what have you seen a healthcare worker do that is going to demonstrate good communication? In this case, I can speak about maybe being an attentive listener, using simple, easy to understand language, being quite tactful. So being sensitive about the fact that perhaps why this mother might be scared. And that could be in contrast to, for example, using complex jargon, or perhaps maybe being a little bit dismissive of the mother. Because as you may know, if you know anything about, for example, phototherapy, and you're not expected to, this is a very routine procedure. And it's something that children have a lot of the time. It's usually not a concern at all when children have jaundice. But kind of the importance of being empathetic here is recognizing that that's not something the mother may be aware of, and so that's where kind of the tactful communication comes in. And this would be something that I expand on a lot more at interview. Actually, at one of my interviews, it did come up. I then want to reflect more on what that made me do. So, what did I learn from the experience? Did I try and replicate those same skills? Did I go on and do a research project? Have I been volunteering and trying to develop my own communication? Why is it important? So, why do medical students and doctors need it? And kind of what were my next steps? So, a very similar structure to STAR, but more focused on how you can learn from other people's experiences and how you can then relate them back to yourself. Now, the medical schools, they're not giving you credit just for passive shadowing. The only time something like shadowing is going to come up is what did you learn from it and how has it given you an increased insight into the role of a doctor? And that's why, for example, it's absolutely not necessary to have these kind of in-person work experiences. If you have them, that's brilliant. But if not, the Medical Schools Council is completely fine with something like online work experience. On our website, we've got stuff for oncology. On Brighton and Sussex Medical School, they've got virtual work experience. Observe GP from the Royal College of GPs. So it's really not a matter of maybe collecting many in-person experiences. It's about a small number of very detailed, personalized reflections.
Yeah, exactly. And like we said, the character count is limited. You won't really have the characters to be talking about five different work experiences. Not that many people can actually access five. Um, and you don't need to at all. It can be really difficult to get work experience. Um, so medical schools are understanding if you can't, and that's why there's loads of online options out there that are just as useful for you to reflect on. So I also use the STAY framework in my personal statement. So when following a patient's orthopedic journey, I witnessed effective communication within the multidisciplinary team. So I've immediately introduced the situation and the theme. I'm talking about communication here. I saw the importance of using patient-friendly language in consultations, so actually talking to the patients, because they don't know all the medical terminology that you're going to know. And it can be quite daunting and it can scare patients. And that's not your intention at all. You're trying to reassure them, if anything. And medical terminology when documenting patient notes and discussing cases, ensuring no ambiguity for patients and their team. So I was really making this distinction here that you want to be using patient-friendly language with patients, but it is really important to use that medical jargon with other members of your team. If you say to a patient, yeah, you've broke your bone here, that's great. But if you then put in the patient's notes, they broke a bone, and then somebody has to go and do surgery to fix like certain fragments or something, they're not going to know what they are exactly doing without having to get an x-ray, etc. So it's really important just to be very clear with the medical team as well. Then I talk about how I use this. So I've applied this skill of being versatile to my 10 months of weekly volunteering at a care home. As many of the residents have dementia, hearing impairments, and varying levels of capacity, I adapt my communication to individual needs, often gesturing and enunciating my words to aid lip reading and understanding. So I've given a clear example of how I've actually emulated this skill. This is really important if you have had a chance to emulate it because you've shown that you've gone there, you saw it, you've thought, wow, that's really important. I want to develop that skill myself. Not that it's important, not that it's just important, but that you can actually take it on yourself. I also try to be empathetic, changing my response accordingly to make residents feel more comfortable, for example, when they experience time shifting. So I've gone in, I've spoke about the skills I've developed there, and then I'm going to link it to another extracurricular to show a bit of intellectual curiosity and a bit of development there. So when residents told me they lacked choices, I was inspired to develop and lead a Next Gen Leaders project where we provided activities that gave residents autonomy. Once again, that's a bit of an ethical situation, autonomy, one of the pillars as well. So definitely go and look at the four pillars and make sure you know what they're all about, and see if you can include them as well. We also shared their stories and advice with younger generations using voice recordings for transcription, so the narrative belonged to the residents. This required consent, so I reached out to a dementia researcher where I developed my knowledge of medical ethics, including how to take consent from patients with reduced capacity. So hopefully you can see there how the stay framework works. It is really useful if you're reflecting to set it out in this format. And yeah, hopefully that is helpful. So then, once you've got your draft together, most of the time people will be over 4,000 characters, and that's okay. But here's a bit of like help how to cut it down. So firstly, you want to consider what the information is telling them about you. Is it really important? Have you demonstrated the same skill elsewhere? So for example, I've spoken a lot about communication. If I'm then going to put in another paragraph on a different experience where I've developed communication, that's great. They can see I've done something else, but is it adding to it? They already know that I've developed my communication and that I can adapt to different people. Is it adding to your personal statement? Same thing. So, for example, do you want to tell them that you got full marks in your GCSE maths, or do you want to show them what your care home volunteering taught you? For me, I'd say definitely the volunteering. It shows them a lot more about you than that you got full marks in GCSE maths. It's not really showing them that you're a strong applicant who's going to be a good doctor one day. Could you cut down your phrases to say the same thing but shorter? Have you waffled a bit in one particular section and you could cut that down? It seems really difficult, but once you know what you're looking for, it is really easy to cut it down. So even small little phrases like including, you can change them to such as or like, and it saves you a few characters here and there. You'll tend to have a lot of long phrases that you can say the exact same thing and give them the exact same information in a much shorter phrase, and that will ultimately save you characters as well as cutting out big chunks of irrelevant text. Then remove any unnecessary adjectives or flowery romantic language. It's not needed at all, and it doesn't actually add to it. So, for example, unfaltering motivation and genuine desire. It's not telling them much more than you have motivation, you have desire. Things you definitely shouldn't include, even when you're below 4,000. Like I said before, mentioning you have family members in the profession, it could make them think your reasons for going into medicine are ingenuine, for example, family pressure. And like I said before as well, Cliche phrases like from an early age or ever since I was a child. Not only are they really long, but it is making them think that you are just saying that to impress them. And it doesn't matter if you only discovered the career a year ago. Okay, so a bit more about my UCAT. We offer reviews of the personal statement. We've got a few different packages. So we've got a super review, which is a written review with detailed line by line feedback, including suggestions for additions, deletions, and edits. All of them will come with explanations to why we've suggested that. And that is £40. We've got the Supreme Review, which is a 1 hour call where you go through the personal statement and make edits with the help of an experienced tutor. So we've got myself, we've got Charlotte, we've got Tanya, we've got lots of experienced tutors who are doing the subject that you're hoping to apply to, who know exactly what these unis are looking for. And that one's £50. And then we've got the ultimate package. So this is unlimited one-to-one or remote personal statement editing and feedback until it's perfect. This will be personally checked by Ojas and a panel of former MMI interviewers at the end. This one's £200. We're guaranteeing you a medical interview from a university, for example, KCL, which shortlists on the personal statement. And if you don't get into that university, get an interview for them, which we're confident you will get your money back. Is there anything more
Just
you
to
want to tell me
add
about?
to, sorry to interrupt, Demi, just to add to those three things, one thing that I've seen in past years, so you see a lot of services that are saying things like, here is the personal statement that got me an offer from Imperial, or here is the personal statement that got me into UCL. Now, if you've been listening to anything we've got to say today, you can see that, for example, Imperial last year had a UCAT cutoff of 3020 and UCL had a UCAT cutoff of 2800. If you met those score requirements, you were given an interview. And if you did not meet those score requirements, you were not given an interview. The rest was down to interview performance. It's not going to be the case for the vast majority of medical and dental schools that these personal statements decide whether or not you get an interview. So before you sign up for something like this, I don't want people signing up because they've seen it on our website and it looks cool. Actually think about what medical and dental schools you're looking to apply to. And depending on that, you probably want to think about what sort of package can be useful for you. So we are going to think very carefully about where you're applying, but you, even before you sign up, should consider this. So something like the top option would be maybe a good option if you're applying to a medical school that does not use the personal statement at all in shortlisting, but perhaps you want to make sure your personal statement flows well so it makes a good impression at interview. And if you're applying to a university like that, maybe after you've finished and drafted your personal statement, you send it over. We just sense check that there's nothing that's perhaps factually incorrect that could embarrass yourself in front of an interviewer, and you should be fine. For the middle option, that might be a good idea if you're applying somewhere like Oxbridge. It means you can actually have a chat about it, discuss some of the scientific topics there. Usually, we'd match a medical student or a doctor in quite senior years so that we can perhaps discuss some of the scientific aspects there in practice for interviews. Now, the final package here, I would really emphasize, is only for a small number of students. And it's only for students specifically applying to universities like Keele for medicine, like Sheffield for dentistry, where the personal statement is actually being used in shortlisting. Now, if that's not the case for you, you probably don't need 5 drafts, 4 drafts of the personal statement because you want to focus on the UCAT first and the interviews later. So the big thing is actually think about how this is being used. And what I absolutely don't want is people signing up if you're applying to, say, Bristol, Manchester, Sheffield, these universities that don't use it at all. And if that's the case, then please don't sign up to our personal statement services if your universities are not reading the personal statement. It's about this actually being useful and this actually helping you get into medical school, not a matter of us making large quantities of money. So really have a think about how your personal statement is being used, what will be useful for you. If you do need support with this stuff, no one has gone through the requirements in this kind of detail. I'm very sure of that because I usually deal with the fallout when people get misinformation and send me questions about it. But do have a think whether this is something you need, and depending on where you're choosing to apply, what actually is it that is going to be helpful for you?
Yeah, definitely. I agree with all of that. So now we're going to go over to you guys, see if you've got any questions about anything we've covered or anything you're particularly worried about. Hopefully, we can give a bit of advice on that.
And what I might do, rather than having everyone spam the chat in one go, I'll probably switch off the recording.